Hi, Dr. William Davis here. I want to talk to you about an aspect of the two common intestinal conditions we've been talking about a lot in the Undoctored program, especially our Undoctored inner circle, and that is small intestinal bacterial overgrowth, or Sibo, and intestinal fungal overgrowth. Now, these are very common conditions, far more common than previously thought. One of the tricky issues here is that when you do the basic program or undoctored, wild, naked, unwashed program, you can regain control over numerous aspects of health. You can lose weight. Type 2 diabetics can become non-diabetic. People with autoimmune diseases can reverse their autoimmune disease. Irritable bowel syndrome, ulcerative colitis, on and on, can be reversed in the majority of people, but not everybody. And some people have residual problems, persistent skin rashes. Maybe their rheumatoid arthritis is 80% better and they're off 2 drugs, but they're still on the 3rd drug and having occasional milder flare-ups. What can you do to get a full restoration of health? Well, think about SIBO and intestinal fungal overgrowth. So explore that in the Undoctored program, Undoctored Inner Circle, but there's something you have to know about. And that is, if you embark on a program to eradicate your SIBO or fungal overgrowth, you have to anticipate a period of bacterial or fungal die-off. In other words, when you take an antibiotic, when you take an anti-fungal agent, and this is true not just in the issues we're talking about here, SIBO and fungal overgrowth. It's also true in other infections of skin, abscesses, abdominal infections, all kinds of infections. There's a potential, what's called a Yarish-Herxheimer reaction, or die-off, bacterial or fungal die-off. When these organisms die, they release all manner of toxins, like some bacteria release what's called lipopolysaccharide. That can make you ill. And fungi, likewise, like Candida albicans, can release their toxins. And so when you first embark on eradicating these organisms from your intestines, you can get a die-off reaction, which is typically low-grade fever, a lot of dark thoughts, depressive thoughts, anxiety, abdominal distress. What can you do to minimize these effects? Because they can be very unpleasant, and they last about 3, 4, 5 to 7 days, something like that. What I've been doing has been working well, and that is start with a weak agent first. So let's say you choose to use one of the regimens that I detail in our Undoctored Inner Circle advanced concepts about intestinal fungal growth eradication. So maybe you want to choose a regimen of turmeric, and then oil of oregano, and lemongrass oil. Those are 3 fairly effective antifungal agents. Well, the weakest one is turmeric. So we start with turmeric maybe for a few days. Even though it's a weaker agent, you can still experience die-off. Then we add the oil of oregano, 4 drops diluted in a tablespoon of olive oil or fish oil or avocado oil. A few days of that, twice a day, and then add the lemongrass oil, also diluted in some oil. If you start with all 3 of those, you could have a very dramatic die-off reaction and be extremely unpleasant. So we start with a weak agent like turmeric, add another agent, 3rd agent, and do that for at least a period of 4 weeks because fungi like to persist for a long time. And similarly, if you have SIBO, you can do the same kind of thing. You can take less than the full dose of whatever regimen you choose, like the candibactin regimen or the FC-cytodispiacide regimen, all detailed in the Undoctored Inner Circle protocols and advanced concepts. But go softly and then build up over a few days. I won't kid you, the die-off reaction can be very unpleasant. It's like an episode of flu. But it will run its course, and take other measures, of course. Try to get enough sleep, hydrate, eat good food. Try to do this during a non-stressful period when you don't have to perform at your best. Know that just understanding these issues and gaining control over them, managing them over time, opens yet another set of doors that give you even better and higher levels of health.